For my behavior change project, I work with Michael, a 3-year-old boy, on increasing the number of his independent manding, which is defined as emitting the first letter sound of the word or approximation of the letter sounds for the item that is desired. For example, he will emit pop for popcorn when he wants access to popcorn as snacks. A frequency measure was used. IOA data was taken by the senior therapist and the clinician on the team, as well as the treatment integrity check. Both remain at 100% throughout all phases. A single subject reversal ABAB design was used. Data was recorded when no intervention was in place for 5 sessions as the initial baseline. Then the intervention was introduced and data was taken for 8 sessions. A return to baseline was implemented for 5 sessions, followed by additional 8 sessions of intervention. During the intervention phase, a prompt delay procedure was used, along with a supplemental question, "What do you want?" as a verbal cue. So therapists pick out a list of items based on Michael's preference assessment and held them up at Michael's eye level to signal their availabilities. If Michael independently emitted the first letter sound or approximation of the sound, immediate access to the item was given, as well as praises. If Michael did not respond within 3 seconds after the presentation of the item, therapists proceed to ask, "What do you want?" and waited for another 3 seconds. If Michael emitted the first sound or approximation of the sound, then it counted as independent mand. Both reinforcer and praises were given. However, if Michael did not respond after the supplemental question or resorted to using his signs, therapists removed the item and presented again, but as an error correction trial. The results were very positive. During the initial baseline, numbers of independent manding was at about an average of 2 times per session. During the first intervention phase, numbers of independent manding increased to an average of about 9 times per session across a total of 8 sessions. During the brief return to the baseline, where no intervention was implemented, independent manding decreased to an average of 5 times per session, which was still significantly higher than the initial baseline of 2 times per session. Upon the reintroduction of the intervention with a prompt delay procedure, the average independent manding increased to about 14 times per session. However, there are still some limitations to this project. The prompt delay procedure was implemented along with the supplemental question, "What do you want?" throughout the intervention phases. It is unclear if and which one has played a more effective role in increasing the independent manding. Further studies should be done separately to see the effectiveness of each individual technique. Also, some studies suggested that the supplemental question, "What do you want?" might produce undesirable stimulus control. Although this study did not exhibit such result, more studies should be conducted with a variety of participants to evaluate the potential side effects of such unwanted stimulus control. Thank you for watching.